Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Before I begin today's update, I want to take a moment to acknowledge the remarkable work of healthcare aides in Alberta. This Sunday is Healthcare Aid Day in Canada. We all owe a debt of gratitude and thanks to these unsung heroes of healthcare. Every day, they provide the direct patient care that helps so many Albertans remain independent and active in their homes and communities. They help support daily living activities for people with medical conditions or functional limitations. And they are vital to providing quality care in continuing care settings and acute care facilities. There are almost 30,000 approved healthcare aides working in Alberta. They have been on the front lines of COVID for many months, and I know this has not been easy. I want to wholeheartedly thank Alberta's healthcare aides for their dedication and commitment to those in their care. Your work is critical. Thank you. Turning to today's update, 18,651 Albertans have now recovered from COVID-19, which is almost 600 more since Tuesday. Currently, 117 people are in hospital, including 11 in intensive care. We continue to monitor these numbers closely. We identified 332 new cases of COVID-19 yesterday, and the provincial lab has completed more than 14,000 tests in the last 24 hours. Our provincial positivity rate yesterday was 2.24% of all tests. Currently, Alberta has more than 2,800 active cases. I am happy to report no new deaths. Turning to schools, there are active alerts or outbreaks in 200 schools with a total of 489 cases. Of these, 91 schools currently have an outbreak, including 22 that are on watch, with 5 or more cases. I want to remind everyone that a school outbreak is called with just 2 cases in a school and does not mean the school is unsafe. As we see community transmission rise, cases in school-aged children are not unexpected. To date, we have seen in-school transmission in only 61 schools, with 2/3 of these only seeing a single new case result. I want to thank all parents, teachers, students, and school staff for your dedication to school safety and preventing widespread transmission. Today, we are updating our public outbreak list. This includes an outbreak in the cardiology unit at the Mazankowski Alberta Heart Institute. The outbreak is currently limited to this unit only, and 3 patients have tested positive. In addition, an outbreak has been declared on 1 unit of the Leduc Community Hospital after 2 patients tested positive for COVID-19. In both locations, all patients are isolated and being treated. Aggressive contact tracing is underway for patients and any staff who may have been exposed. Outbreak protocols are in place, including enhanced cleaning and twice daily symptom screening for both patients and staff. AHS is investigating the outbreak and working hard to protect the health of all involved. The recent outbreaks we have seen in hospitals are one of the reasons for the high hospitalization numbers that we are now seeing. As our community transmission goes up, so too does the risk of introducing the virus into our acute care and continuing care facilities, where our most vulnerable community members are. This is another reminder we all have a role to play in stopping the spread. Today, the City of Calgary is shifting onto the watch list. There are currently 686 active cases, which is 50.9 per 100,000. We have recently seen several outbreaks in that city linked to social gatherings. And this is yet another reminder that no region is immune from this virus, and that one case can quickly lead to many if restrictions are not followed. At this time, I am not recommending any additional measures from Calgary, but we are working with local partners to monitor the situation closely. I continue to be concerned about the situation in Edmonton zone, which currently has 54% of the active cases in the province. It takes about 2 weeks between actions and outcomes, so we would anticipate seeing in the next week or so if the voluntary measures we put in place for Edmonton last week are having an impact. However, this weekend, I am asking everyone in the Edmonton zone to continue following these voluntary measures to the best of their ability. Follow them every day in whatever you are doing. First, please limit all family and private social gatherings to a maximum of 15 people. The fewer people you have, the lower the risk of exposure or transmission. When you are gathering, please be sure to follow all the other public health measures that we all know so well by now. Second, please keep making sure that masks are worn in all indoor work settings, except in personal workspaces such as cubicles or offices where the worker is safely distanced or an appropriate barrier is in place. I know this can be frustrating and inconvenient at times, but we are seeing cases where the virus is being spread at workplaces, often by people with very mild symptoms who've not stayed home or those who have not yet had symptoms start. Finally, I am asking each person to limit your close contacts with others and limit contacts between networks. The guideline for how to do this is through limiting cohorts to no more than 3. A core household and social cohort, including up to 15 people outside your household, a school cohort if applicable, and only one other sport or group. Young children who attend childcare could be part of 4 cohorts, given that childcare contexts have not been seen to be a high risk for spread. To be clear, this is 3 cohorts per person, not per family. While these measures are targeted at Edmonton, anyone can follow them regardless of where you live. We must all take precautions to limit the virus's spread to our friends, family, and loved ones. With that in mind, I want to end today with a request for all Albertans. Please get your flu shot. Influenza is not new like COVID-19, but it is very serious. Last winter, almost 8,500 Albertans contracted the flu, and ultimately 41 died. Last year, about 1 in 3 Albertans took the step to get immunized for influenza. This was more than in 2018-19, but we can and must do better this year. Starting on Monday, the flu shot will be readily available in participating pharmacies, doctors' offices, and health clinics across the province. Getting immunized is an easy way to protect your health. The flu shot won't prevent COVID-19, but it will reduce your chances of getting sick with influenza and spreading it to others. Seniors, young children, pregnant women, and those with chronic health conditions are the most at risk of suffering severe and sometimes fatal complications from the flu. Also, by getting immunized, you are helping support Alberta's pandemic response. We can't yet prevent COVID-19 with a vaccine, but we can help stop the flu from taxing our health system. This year, we must support those with influenza, COVID-19, and all those with other health needs in the province. The more that we can avoid influenza-related tests, emergency visits, and hospitalizations, the stronger our system will be to support those with COVID-19 and all other health needs. It is vital that we all protect ourselves from influenza. Starting Monday, the influenza vaccine will be readily available at pharmacies and doctors' offices for anyone over the age of 5. AHS is delivering vaccine this year by appointment only for younger children and their households, for people who don't have a provincial health care number, and where there is no other immunization provider. Please book your appointment as soon as possible. Getting a flu shot is the right thing to do. It's good for you, for your community, and for the health system. In closing, I want to share a story that I think speaks to our current situation. Last night, in preparation for the snow that was forecast to hit Edmonton today, I was outside in the dark planting wildflower seeds. This struck me as an apt metaphor. We are going into a cold, dark time of year, but it will come to an end. We have to hold on to the seeds of hope and know that if we do our part to protect each other in this difficult time, better testing technology, treatments, and vaccines are in the works to join the fight against COVID-19. Spring will come again, and we will get through this together. Thank you, and I'm happy to take any questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
Yes, thank you. The first question is from Jesse Weisner, Global TV. Jesse, please go ahead.
Hi, Dr. Hinshaw. Some Alberta doctors say reports into the outbreak at the Misericordia Hospital in Edmonton are complete but haven't been released in light of more recent hospital outbreaks like the Foothills and another at the Misericordia, and with flu season coming. Why haven't those findings been released so health officials can use them to help manage current and future outbreaks? And do you think there should be an urgency behind the release of the reports to help with handling further outbreaks?
I would agree that it is important that those findings are released, and we're currently working with Alberta Health Services to determine which parts of the report are able to be shared and which parts may contain identifying information that we couldn't release. And so that work is underway. As I say, I do think it's really important that everyone understands the outcomes, and I will say that the lessons learned with respect to some of the risk factors that were identified at the Misericordia Hospital have already been put into place. So there are certain things such as identifying risk factors in individuals who have severe cognitive impairment or dementia, and the risks of spread in those either hospital wards or long-term care facilities with individuals who have that condition. There's a lot of work underway to incorporate some of those lessons learned. So yes, absolutely, those lessons do need to be shared more broadly, but we are working on solutions within the healthcare system even before the public release of those reports.
Operator, could you put through the next caller, please?
Julia Wong, Global News.
Hi, Dr. Hinshaw. Thinking ahead to holidays like Remembrance Day, they typically have large crowds and attendees who are older. So how should organizers be planning for this event, or should they even be holding them? And how should Albertans mark the occasion?
Remembrance Day is an important time to remember the sacrifices that have been made on our behalf as Canadians. And so certainly it's an important date to mark and remember, and it's important to do that in a way that's safe. The guidance that we have with respect to gatherings, both indoor and outdoor, would apply to any type of gathering, whether that's Remembrance Day or anything else. And so I would encourage organizers of those events to have a look at the gathering guidance and to make sure that basics such as screening people who are coming to make sure that they are not symptomatic, to make sure that they're not close contacts, making sure that people are distanced, making sure that if there's any chance that they may not be able to maintain distance at all times, that their masks are worn. Those are the basics that would apply to any gathering. And again, there is detailed gathering guidance available on our website that organizers could use as they're planning these events.
Operator, could you put through the next question, please?
Yes, the next question is from Jason Herring, Global Air Post Media.
Dr. Hinshaw, today is the second highest number of new COVID-19 cases since April. Since Alberta no longer provides updates on COVID-19 case numbers on weekends, we won't hear another update on cases until Monday. I'm wondering if there's any plans for Alberta to resume weekend reporting, and if you're worried that not reporting on weekends could undermine the seriousness of this recent spike in cases.
It's important to remember that while our public reporting happens only during weekdays now, that doesn't mean that our action to prevent the spread of COVID-19 stops on weekends. So we still continue to have contact tracing, testing, swabbing, all of that work continues over the weekend. And that, again, doesn't... The fact that we are not releasing numbers doesn't impact all of those other efforts that are underway. I think it's very clear to Albertans that our numbers are of a concern, certainly in Edmonton, again, where 54% of our current active cases are. We have seen that rise that we were concerned about last week when our voluntary measures went into effect. And I think that it is clear to all Albertans, whether they're in Edmonton or other parts of the province, that again, the spread of this virus is in our hands. So we aren't looking at changing our reporting mechanism, because having reports does take quite a few staff. And as you can imagine, our teams have been working very long hours for many, many months. And giving them the ability to have a bit of a rest is critical. And so right now we are focused on making sure that the activities to prevent spread of COVID are happening 24/7, but that reporting really is focused on weekends. And we encourage Albertans, of course, to maintain all of those public health measures, whether it's a weekend or a weekday.
Operator, could you put through the next caller, please?
Yes, the next question is from Janice Johnson, CBC.
Dr. Hinshaw, in your comments, as you just mentioned, 54% of all active cases are in Edmonton. You also said that we should make sure that masks are worn in all indoor work settings. Now, yesterday, the Solicitor General of Alberta met with 4 members of the Chiefs of Police, and afterwards they posed for a photo. They were not socially distanced. None of them were wearing masks. I'm wondering what your reaction to that is and what message you think it sends out to the rest of the province.
You know, I have to say, as I've said before, that I personally, although I do try my best to follow all of the measures, sometimes I slip up, and I am always grateful when people bring that to my attention and remind me. Perhaps I didn't wash my hands or sanitize my hands when I touched a door handle. You mentioned distancing and masking, and I think there's opportunities for all of us to be reminded about the importance of these measures in a way that is encouraging to all of us. And so I would say, again, whoever those people are who may have forgotten some of those measures, again, it's that gentle reminder and the encouragement that we do all need to stay in this together that is important to, again, make sure that we're not pointing fingers or stigmatizing, but rather encouraging people to remember the next time that these are the measures that we all need to follow.
All right, I see 2 more in the queue. Operator, could you put through the next question, please?
Matt Woodman, CTV.
Hi, Dr. Hinshaw. Back in the spring, we saw bicycle sales increase, and now with winter approaching, it appears sales for winter sports equipment are also increasing. Now, not to make light of COVID-19, but is this increase for this increased desire to be outside and get active, is this perhaps a small positive to the pandemic?
It's a good point, and I certainly have heard from people who've reported to me, again, anecdotally, that the opportunities provided for them during the pandemic have helped them to consider what's most important in their lives. Again, the encouragement to get outside and be active in spaces where COVID transmission is less likely is perhaps, again, some of that small silver lining. Of course, COVID's brought with it many things that are not good, but I think it is right to point out that there are a few side benefits, and certainly I would absolutely encourage all Albertans to think about how they can continue to be outdoors and active even as the winter months approach.
All right, we have time for one final question. Operator, could you put through that caller, please?
Yes, Dylan Short, Edmonton Journal.
Hi, Dr. Hinshaw. I was hoping you could touch on the outbreak at the Hope Mission shelter in Edmonton. Obviously, a shelter like this, it's essential and it keeps people in close spaces. So I was hoping you could touch on maybe some of the difficulties of controlling an outbreak at a place like this and what currently is being done by the operator as well as the different government organizations involved in controlling this outbreak.
Sure. So the Hope Mission outbreak has 15 total cases, 13 of whom have recovered. So there are only 2 active cases right now. I don't personally get involved in the details of managing each individual outbreak just because there are many across the province. So if you're looking for specific details of any individual outbreak, local public health or the local organizations would have more information. But in general, of course, managing outbreaks in shelters where people who are experiencing homelessness spend part of their time can be challenging, as the population can potentially be transient. Not everyone perhaps returns to the same place every night. And so I know it is critical, and have spoken with my colleagues in the Edmonton zone about the importance of working collaboratively with all the agencies who serve that population experiencing homelessness to make sure that there's an awareness of what's happening, that people have the supports that they need if they are close contacts of a case. And again, I think it's encouraging in this particular case that the majority of cases in this outbreak have now recovered, although of course a lot of work continues to be underway to make sure that prevention continues.
All right, thank you all for joining us today. We will provide updated data from the weekend on Monday, and Dr. Hinshaw will hold her next availability on Tuesday afternoon. Thank you.